Welcome to Nerdy Medics. Here we are with another brand new lecture on osteopetrosis. It is a clinical syndrome characterized by the failure of osteoclast to resorb bone. Impaired bone modeling and remodeling results in thick, brittle bones, i.e., marble bones, which are woven in nature, thus making them fragile. Presentation is highly variable, ranging from recessive, infantile malignant osteopetrosis to dominant, Albers-Schoenberg disease. Okay, so in osteopetrosis, osteoclast number may be normal, decreased, or increased. Most importantly, osteoclast dysfunction mediates the disease. It results from mutation of genes, for example, carbonic anhydrase 2 gene mutation interferes with the process of acidification of the osteoclast resorption pit, which is required for dissolution of hydroxyapatite. This step is important for bone remodeling as new bone replaces old bone, but in this condition, osteoblast keeps on depositing new bone over the older one. TCIRG1 gene is mutated in 50% of autosomal recessive forms, and CLCN7 is mutated in 75% autosomal dominant forms. In infantile malignant osteopetrosis, patients presents with cranial nerve defect, optic atrophy, deafness, facial paralysis because of narrowed foramina leading to nerve compression, hydrocephaly caused by foraminal narrowing, fractured bones because of thick woven bones, pancytopenia resulting in anemia, leukopenia, and thrombocytopenia because medullary cavity is filled with primary spongiosa, leaving no room for hematopoietic marrow. Hepatosplenomegaly as a result of extramedullary hematopoiesis. Defected dentition. Stunted growth. Scoliosis. Craniosynostosis, early closure of sutures causing stunted brain development. Snuffling, nasal sinus architecture abnormality. Patient presenting in adulthood with Albers-Schoenberg disease will have cranial nerve palsy, osteoarthritis, carpal tunnel syndrome, mild anemia, or found incidentally on an X-ray. Infantile malignant osteopetrosis can be seen on plain film as defective dentition, poorly pneumatized paranasal sinuses, craniosynostosis, thick calvarium resulting in poor brain development, narrow foramina, while an adult form will be seen as diffuse osteosclerosis, cortical thickening and loss of medullary space, Erlenmeyer-Flask deformity that is relative constriction of diaphysis and flaring of the metaphysis, endobone that is bone within bone appearance, sandwich vertebrae, Rugger Jersey spine. This is seen as alternating sclerotic and radiolucent areas. Here in the first image, sandwich vertebrae is visible on lateral view of spine. Prognosis is poor in recessive form if not treated promptly. Hematopoietic stem cell transplant has shown good results in infantile osteopetrosis. Gamma interferon can improve blood count and decrease risk of infections. Erythropoietin has been used to treat any associated anemia. Corticosteroids may alleviate both the anemia and stimulate bone resorption. Vitamin D, calcitriol, appears to stimulate dormant osteoclasts, which stimulates bone resorption. Okay, as a quick recap, osteopetrosis, also called marble bone disease, is a genetic condition resulting in defective osteoclast activity, which in turn affects bone remodeling. It presents in two forms: adult mild osteopetrosis aka Albers-Schoenberg disease, which is found incidentally on X-ray as patients are mostly asymptomatic. The other severe infantile form presents early in life with multiple symptoms like craniosynostosis, cranial nerve palsy, scoliosis, etc. Milder condition can be treated symptomatically, while severe condition might need a hematopoietic transplant for better prognosis. Thank you for watching. Like, share and subscribe to our channel, and if you don't want to miss any of our videos, turn on the notification bell.